Well, welcome to today's update. News isn't particularly good today from Australia, Europe or the United States. But before we go on to that, I'm just going to give us a sort of snapshot of different countries and how things are going in those countries. So here we have the United Kingdom. Now, I've arranged all of these as per million cases, so we can compare these numbers. So 350 there for the UK, but cases increasing as we see. Doing quite well for a while, then kind of bouncing back up again. Now this is Sweden. Again, higher numbers per capita in Sweden. We see it's 600 per million there per day, just over in fact. Czechia, the country that was the Czech Republic, again a bit of a winter bounce back. Denmark, very sharp increase in cases in Denmark. Africa, now very limited data in Africa, and again we notice the numbers per capita here are remarkably small, but basically we don't have a lot of data from Africa, but it does look like things are starting to increase in Africa. Canada, trajectory is up. Spain, again starting to bounce up a little bit. Germany, we know there's increased measures of lockdown in Germany at the moment. United States, high numbers indeed. Netherlands, similar numbers per capita, but heading sharply up the way. And Switzerland also, again, this kind of rebound pattern that we're starting to see in quite a few places now as winter approaches. So I just wanted to do that as a bit of a sort of a sketch in for a bit of a background, and we'll look at some other websites later. Now Australia. Let's just have a quick reminder of Australia. So this is the official Australian government site. So this was Australia's first wave, second wave here that was brought under control, and these sort of random noise here has mostly been cases that were picked up in quarantine, which of course is good because it means that the infections haven't been spreading around Australia up until yesterday in fact. And in New South Wales yesterday there was 15 cases of local transmission, and the source of this has not yet been identified. This is the concern. Where has this come from? So there's been some community transmission, unidentified source. Sydney area, 2 weeks completely clear, absolutely brilliant. Not many people wearing masks in Sydney, although I suspect that's changed as of today. Northern Beaches region, 28 cases according to the popular press. So I suspect that these cases in the popular press will be reflected in this official data tomorrow. So I expect that'll be plus whatever half of that is, plus 13 or something tomorrow. Unknown origin, Queensland, one case, local transmission. Now, the overall numbers of cases here, of course, would be envied by any other country in the world. They're phenomenally low. We're talking about 28 new cases. But after 2 weeks in the Sydney area with no cases at all, disappointing. I do strongly suspect, given the track record of the Australian authorities, that they will have this under control fairly quickly. But it really just shows that this hasn't gone away. You know, this is not going to be over for anyone till it's over for everyone. Now, moving on to the United States. Quick look at the overall situation here. We're going to look at California in a little detail, which has got quite a few new cases, unfortunately, in the past 7 days. 250,000 of them, in fact. And these are the states with the most cases in the last 7 days: Tennessee, Oklahoma, Rhode Island, Arizona, Indiana, if I can say it properly, California, and we go down the list that you can peruse for yourself. This number is already past 17 million, so this is live. I mean, we're here on Friday evening. It's live on the website. It's just that the official website is behind the actual numbers by about 24 hours in this case, probably. In fact, probably more than that. It's quite a bit behind actually. But this is live. It's all we've got. So trends in the States. Well, this is it. If we take the average, not going to give us that. Is it going to give us the average? Yeah. 7-day moving average, 212,000 new cases per day in the States, and deaths also starting to increase really quite significantly in the States. Don't think it's going to give us that, is it? Anyway, we've got it written down. So that's the situation on the official government sites from the States. I've got some slightly more up-to-date information here as well. But California, first of all, has been described as a new epicenter. Now, there's been 50,000 new cases a day, 100,000 new cases in the last 2 days, Wednesday, Thursday. And this is slightly below the real number. So over 100,000 new cases in the past 2 days in California, a significant increase in transmission in California. The positivity rates are well over double the epidemic threshold, 11.5%. So for every 100 tests being done, 11.5% are coming back positive. And the deaths in California are also increasing. This positivity rate means to me that there is a lot of virus around in California. Therefore, it's likely that these rates will go on increasing. Now, the problem is the rates have been increasing for some time now. And as we'll see, some hospital facilities are already full, and yet rates will the number of sick people will carry on increasing for some time. So, not pretending there's no issue in California, there certainly is. So, Southern California, Los Angeles, San Diego, as of yesterday, 0 ICU beds, and as we said, the cases have increased in the past. So that the people in ICU now were getting infected and sick 10, 14 days ago. And we know there's more of them to come. Because of the increasing cases, there's going to be more demand. And how that's going to be met at the moment is simply unclear. It's going to be a significant challenge. Christina, Ghaly, Los Angeles County Department of Health Services. I want to be very clear, our hospitals are under siege and our model shows no end in sight. The worst is still before us because of this delay effect. So basically, in some parts of California, they've run out of some aspects of hospital care, is what we're saying, and that is a significant problem. Gavin Newsom, Governor, mass fatality plan has been instigated. 60 refrigerated storage units, always ominous. Now, I don't think it's quite as bad as I'm painting. You know, we're talking about one of the richest states in the United States here, and the ability of the United States to organise resources once it gets into gear is immense. I believe they will answer this problem, but at the moment, how that's going to be answered is not really clear. She carries on and says, "Oh no, this is who's saying this? No, this is Gavin Newsom saying this, the governor. We're going through perhaps the most intense and urgent moment since the beginning of this pandemic. I'm afraid that's true. As Mr. Newsom has identified, we're not at the finishing line yet, so please be mindful." Absolutely. So difficult times ahead for California, and of course we're still got January, February to go yet. The vaccine's being rolled out, but it's not going to make a dent in this in any meaningful way for another month or more. Now, anyway, moving on to better news. Mr. and Mrs Mike Pence have both been publicly vaccinated on TV. I believe it's on TV, certainly on video, indicating they trust the vaccine. If you're watching this video, I strongly suspect you do, although it is incredible how many conspiracy theories about the vaccine I get in the comments. Now, we don't encourage this. People are free to express their opinions, of course, but we certainly wouldn't respond to these types of comments unless they're genuine queries. Then we can respond to them. I mean, some people have genuine questions. We can respond to that, but some of the silly things that are being said, we can pass on from that. And anyway, Mr and Mrs Pence have both been vaccinated on TV. Now, Mr Trump has said Moderna's Inc., the Moderna Corporation's vaccine, has been approved and will ship immediately. Now, as I'm speaking, it's about 5 p.m. on Friday in the United Kingdom here, so it's earlier in the States. This is not accurate as of yet. Now, I have predicted that the Moderna vaccine will be given the green light by the FDA today. So, to give Mr Trump the benefit of the doubt here, I think it's reasonable to assume the President of the United States knows more about it than we do. So I'm hoping that's going to be today. Then we'll have the Pfizer vaccine and the Moderna vaccine. And of course, the United States has got 100 million doses of Moderna vaccine pretty well ready to go. That's going to go out quick, but it's not going to make a significant difference till March, realistically. Well, they've ordered 100 million doses. They've got several million doses ready to go. And I would expect they'd be shipped out tomorrow. Let's hope that comes true. Now, other news from the States. State and federal prisoners, 1 in 5 has tested positive so far, giving 275,000 infections in prisoners. So over 1,700 deaths in prisons. And it's still growing at a fast rate. So this is still growing fast. Way higher prevalence rate than the general population. And that is an issue. The United States has one of the highest incarcerated ratios of people in the world, and the infection rates are still growing quite dramatically. Now, coming on to the figures that we have looked at here, that was the deaths, and here's the cases. Lots of data there if you want to go and look at it. Of course, I include the link. So past couple of days, this is what we're looking at. Basically, we're looking at, that would be Wednesday, that would be the increase on Thursday. So we're looking at 250,000 new cases per day in the United States. So the latest figure I've got from Johns Hopkins, before it just came on air, is just over 17 million, well, 17.25 million nearly. So this is a dramatic increase in the States, and it's been sustained for some weeks now. So it's been running at about 10% rolling average for the past 7 days. It's now 9.7% rolling average for the past 7 days. So these rolling averages are quite useful. So tomorrow they'll take the rolling average for today and the 6 days before. Then the day after that, again, so it's always like based on the last 7 days data. So it's been around about 10% increase. Now it's 9.7%. Testing in the United States is good still. That's up 6.2% in the past 7 days. Hospitalizations now stand at 114,000. This is the number in intensive care, 21,900. So that's in intensive care or critical care unit. People call them the same thing. It means the same thing. Sometimes it's intensive therapy unit, sometimes it's critical care unit. It's the same thing, basically. Well, it is the same thing. 7,847 patients on ventilators. So less people being ventilated because we know that's associated with the poor prognosis. So that is good to see that that's being done. Deaths running over 3,000 a day for the past 3 days. Now at well over 300,000 deaths. So 3,000 deaths per day at the moment is kind of the number in the United States. So in terms of those trends we're looking at, do click on the links. They're all there for your perusal. Now moving on to the United Kingdom. News isn't really a whole lot better. Probably not quite as bad as the States, but the Office of National Statistics pointed out yesterday that 1 in 5 people in the UK, based on their extrapolation of their data, admitted indoor mixing outside their bubbles in the last week. This means there is going to be increased infections. 1 in 95 people in England at the moment, I believe it is, are infected. So 1 in 5 people for the whole country mixing indoors and 1 in about 95 people in the country infected. You don't have to be a genius to work it out. This is, people are breaking the rules. It's that simple. If you're planning a Christmas bubble, limit contacts now, according to the Prime Minister. But of course, it's not that far away. We've only got about 5 days till the Christmas liberalisation in regulations kicks in. So what Boris Johnson is saying here is, well, if you know you're going to be exposing or potentially exposing an elderly relative, make sure you're not infected when you do so. This is not ideal. It's better than not taking any precautions before you enter your Christmas bubble at all. But really, we know that the messages giving out here are not. This 3 household thing. It's an allowance, but people will many people who don't watch this video will take that as license to do much more, I'm sure. And there will be a dramatic increase in cases in January. Unfortunately, that is true, as we've seen in the Thanksgiving surge in California, which is part of the reason we have this surge in California. Now, official data from the UK. Let's have a quick look at that. So we have official data from the UK. So these are people testing positive, cases by specimen date, and by date reported. And we can see really quite high increases expected there, and high increases already happening in cases by date reported. Healthcare provision, also new cases. Now this had been going down nicely, it's going up. Total number of people in hospital also going up, and it's pretty well not far off where it was. So just under 17,000 now, just under 20,000 at the peak. I had predicted it wouldn't go above this, and well, it didn't. It started going down, but now it started going up again. So that is clearly a real and present risk. And the deaths in the UK as well, dropping off because of the decrease in cases we've had over the past few weeks. But within 28 days of a positive test diagnosis, pretty well flattening out. So deaths hopefully will stay low for another week or so, but then they will start going up because of the increase in cases that we are now having and had for the past week or two. So it's not ideal, really. It's bad, really. So cases, increasing cases, that was Thursday, that was Friday. Officially diagnosed cases now getting on for 2 million. The real number is much higher, of course. Hospitalised, that's the number of people that have been hospitalised in 2020 with COVID-19. That's the increase, and that's the total number now. Just over 18,000 is the total number hospitalised now on Thursday. That's Thursday's data. Deaths are also increasing. These are deaths within. These are deaths within 28 days of a positive diagnosis. So that's 532 increase in 24 hours. This is the death figure as reported by death certificates. So that's increased by 3,160 in the past 7 days. So death figure from officially reported cases, the perhaps more accurate death figure from death certificates, now 76,000. And of course it's only going to carry on going up, at least for the time being. Now, Northern Ireland, new lockdown on the 26th of December has been agreed. Now, I actually deliberately left in that word there, I put in that word there, agreed in Northern Ireland, because what's happening there, pandemic-wise, of course, is not good, but it's quite incredible, if you know anything about the history of the UK and Northern Ireland, that all the politicians there are agreeing on this. This is something the politicians have agreed on and are moving forward in what they all consider to be the best interests of the people. And it's just good to see politicians in Northern Ireland agreeing, and I just hope that some good comes out of this and that spirit of cooperation can continue. So there's going to be a lockdown for 6 weeks, a review after 4 weeks from the 26th of December. That's now been agreed. First week, even essential shops are going to close by 8 o'clock in the evening. No sporting events permitted at home. Lots of other lockdown measures. People are being asked to leave home only for essential reasons. So First Minister Michelle O'Neill, the health services would be completely crushed in January if we didn't intervene now. So while this is draconian, it's about saving lives. We've never been in such a bad position as we are now, and will be in January if this didn't happen now. Anticipation of the hospitals being overwhelmed. And various measures, closure of non-essential retail, click and collect services will not be permitted. That's very strict. So you can't click and collect, takeaway and deliveries only, no eating or drinking indoors, of course. Closure of leisure, sport and entertainment facilities. So bad things happening in Northern Ireland, but good to see there is agreement on it. Wales is going into lockdown from the 28th of December. Ironic that we're having this time off over Christmas when the virus won't be having time off, but yet Wales is going into full lockdown after the 28th of December. England, cases up 46% in the past week. In the southeast of England, cases up by 46% in the past week in southeast England. Yeah, in southeast England, it's a big increase. So that part of England particularly going up, and we'll look at a map of that just to clarify that. 68% of England's population, 38 million people, are in tier 3 from tomorrow. So basically, most people in England are in what is essentially a lockdown, or near a lockdown. 30% of the population are in tier 2. That leaves 2% of the population that are in tier 1. And here's the map. So we see this darker area here is all tier 3, all throughout the Midlands and the Northwest, and London in the east, all in tier 3. The only tier 1 places are that area there, that area Cornwall and Isle of Wight. I did get, what is that area there actually? That's I think that's what do you call it? I think that's Brecon area. Anyway, I did say the Isle of Man last week. I was wrong. The Isle of Man's out there somewhere. I did mean the Isle of Wight. So anyway, the majority of England's population, in other words, under the higher tier restrictions. Scotland, next Tuesday's decision-making point whether they go into a lockdown like Northern Ireland and Wales. They probably will. 23rd to the 27th of December, bizarrely, is still the same. I mean, to be fair, this was announced when things weren't so bad, but the Scottish Government are imploring people not to take advantage of their what they're legally allowed to do, and have advised much, much tighter restrictions. Now, just to finish off, is for national statistics, week 6 to the 12th of December. England in this week, always a slight delay, of course, 6th to the 12th of December. Over 500,000 cases, 1 in 95 have the virus that week. Increasing positivity in London, east of England, East Midlands, South East. Decreasing positivity, North West Yorkshire and the Humber. So slightly different trends in different parts of the country. Oh, that's true. Wales, the prevalence, 33,000. That's 1 in 90, so slightly higher prevalence in Wales than in England. Northern Ireland, of course, as we said, going into this lockdown, their numbers aren't quite as high in terms of per capita, but they are getting near the end of their hospital provision, and this is being titrated against hospital provision. Their lockdown is being titrated against hospital provision. Scotland, about 1 in 100. Now, France, Emmanuel Macron, 42 years old. Wednesday evening, cough, high temperature and heavy tiredness described as. Self-isolating for 7 days. So it sounds like Mr Macron has got quite a severe case of COVID-19 and really quite symptomatic. Infected at a European summit in In Brussels, 20 hours with other European leaders, including a working dinner. One of the perks of being an EU leader, I bet you get nice dinners. But unfortunately, this has caused looks like this may well be the cause of his infection. Madame Macron is tested negative and is isolating separately. Right, that's all we had to say today. I'm going to look at a few of your pictures that illustrate the pandemic, but before we do that, let's just get some words of wisdom from Steve, who's written in. Don't sit and meditate, hurry up and ventilate. So that's a good one. Thank you for that, Steve. The importance of ventilation. It is catching on. We have shown this graphic a few times, but it's still not where we would want it to be. Many places are still not well ventilated, thereby increasing viral load. Good. Well, thank you for watching this video. I'm just going to close with a few pictures. So this is from Judy in Wyoming. We're going to start off with here. There we go. Now it looks like Judy has been vaccinated. Excellent. With the Pfizer vaccine, of course. So thank you for that, Judy. Good to see. And the place for the second dose is waiting. And Judy is I don't know. You're obviously a healthcare provider. I'm sorry, Judy, I can't remember what you did. I think you might be an ITU nurse, but excuse my ignorance. Anyway, glad to see that vaccine is rolled out there it's starting to be rolled out to healthcare workers. Really good news. Now this is another Judy in Florida this time. Good. So this is actually a polo match, but it's glad to see there's outside plenty of ventilation, mask wearing and unoccupied seats. So it looks good from where I am. Maintain social distancing, keep one horse apart. Good. I think everyone's got that message now with a different. The other day it was dogs the other day, wasn't it? 2 Great Danes or 6 Dalmatians. 2 Great Danes or 6 Chihuahuas or something like that. Okay. Anyway, the trends are concerning. There's no two ways about that, and they are going to carry on getting worse for some time. Not mixing over Christmas, unfortunately, is going to be essential. Personally, I am not going to be meeting family over Christmas for meals or anything like that. It's just too big a risk, and many other people are making the same sacrifice. I'm hopeful we can celebrate Christmas in April once the vaccinations have kicked in. One disappointing thing, I really hope the Oxford vaccine will be approved this week, but by the UK regulatory authorities, but it hasn't happened. So it looks like they might be waiting for the American data to come in. And if that's the case, it means the Oxford vaccine will probably not be passed, whatever the term is, authorised, until early January or even mid-January. I'm happy with it from the data that we have from the peer-reviewed publication, but obviously the regulatory authorities have much more information than you and I, so we have to go by their decision. But disappointing. But if you're in the States, hopefully by the time you're watching this, the Moderna vaccine will be authorised. I really believe that should be, well, it should be today. I'd be very disappointed if it's not. Okay, thank you as always, of course. Always great to have you.